Hello and welcome to the Dementia Doctor. In this particular episode, I'm going to talk about some of the life-changing things that you're going to hear. So about a few days ago, someone contacted me and said, Dr. Verma, we want you to come to this group of patients who have dementia and their family members, but we want you to talk about something hopeful and something positive related to dementia. And that got me thinking, something hopeful and something positive related to dementia? And actually, I didn't have to think a lot because to my mind came a paper that was published in 2024, and it was called as the Lancet Commission for Dementia Prevention. And what this paper showed us was without any new inventions, new medications, or any new technology, we can prevent about 40% of dementia cases. Now think about it in real numbers. Just with Alzheimer's disease, we have about 7 million Americans living with this disease. So when we think about in numbers with other kinds of dementias, this can have a huge impact. So let's get started right away. So when this paper was written, they divided these modifiable risk factors into early, mid, and late life. Now, when we use the term modifiable risk factors, what this basically means is that if I don't take care of these things, I can increase the chances of developing the disease. But on the other end, if I do take care of these risk factors, I can modify my risk of developing the disease. And that is why even when we are talking about them being risk factors, this is fairly a very positive thing or a hopeful thing to look at. And as we just said, by just working on these risk factors, the number is drastic. The number of dementia cases that can go down is 40%. It's huge. So talking about these risk factors by the times in life, early life includes having a higher level of education. And you may say, why is that? Well, when we are challenging our brain, it does help us develop what we call as cognitive reserve. And when we talk about cognitive reserve, I would like for you to imagine having a bank balance. And when we are starting to deposit money early on, we are more likely to have a higher balance in later ages. Similarly, challenging your brain when your brain is developing has extremely beneficial effects on our cognitive health. And it is to the extent that out of all the things that we can do for our brain, this stands on the number 2 position. Now, moving on to midlife, where most of the modifiable risk factors live. And I'm smiling because most of my families that bring seniors are the family members who are actually themselves in midlife. And this is a time of our lives when we are busy building a career, we are busy taking care of our parents, our children, and trying to stabilize everything. However, this in the world of dementia is the most crucial age, and therefore this is the time that most of these risk factors or modifiable risk factors live. So let's talk about them one by one. Interestingly, the number 1 risk factor that you can work on also is present during the midlife, and that is hearing loss. So my dementia clinic, when I'm seeing individuals, I often talk about hearing loss. And when I ask the question, some of the times family members look at me and say, why are you asking that question? This is a memory clinic. And I know this connection is a little difficult to make, but hearing is one of our sense organs, and our brain has different regions kind of dedicated to do different functions. Similarly, there's a large part in our temporal lobe that is right under the temporal bone that is dedicated for hearing. And temporal lobe is also the place where the memory centers are. And so what brain does is it's a very smart machinery. And so for some reason, I'm not using my ears and I'm not using the sense organ, it does decrease function. It does kind of reduce function in that area, and it becomes more likely to have shrinkage in those specific areas, as well as an increased risk of having cognitive decline or dementia. Now, this actually tops the list. So just imagine how important your hearing is. And it should not be a coincidence that it lives very close to your memory centers. Now, moving on to the next big group of things. This includes something that again confuses my families when I'm doing patient consultations. So this is your heart health. Everything, almost everything that affects your heart health also affects your brain health. This is things like cholesterol, high blood pressure, things like having a history of smoking or diabetes or obesity. All these factors are included in this heart health, and then they eventually also affect your brain health. Therefore, these risk factors are termed as vascular risk factors, that is, things that affect your blood vessels, and they're also something that can affect your brain health. So let's talk about them one by one. Cholesterol, the bad kind, that is also called as LDL, low density lipoprotein. So when you get your cholesterol blood report, try to look at this number. This is one of the most important numbers in your cholesterol blood report. So this cholesterol goes and deposits in the large blood vessels in the brain. And if you imagine that this is your artery that is giving blood to your brain, if there is cholesterol sitting in the way of the artery, this will reduce the good oxygen and the good nutrients that your brain gets, and over time, getting less blood supply will result in brain injuries. Similarly, when we have high blood pressure, this actually affects the smaller blood vessels. And what it does is that when our small blood vessels, which are used to seeing a good normal blood pressure, when they see a higher blood pressure, they prepare for high pressures, and what they do is their walls start thickening. So the walls become thicker and thicker to the point that again, our brain does not get enough of the good oxygen and nutrients it needs. Now, along the same lines, when people have obesity, they have a higher risk of developing diabetes, high blood pressure, and cholesterol, and increasing their chances of developing vascular dementia, which we know is a kind of dementia. Now, you may ask, what about smoking? Well, smoking causes some kind of squeezing of the blood vessels, and the whole idea that we have been discussing is that any reason that your brain does not get enough oxygen and nutrients will cause injury to the brain. So these are the other bunch of important risk factors that need to be addressed during our midlife. Now, another thing that happens during the midlife that needs to be addressed is our mood. Having depression in midlife is associated with an increased risk of having cognitive decline in the later stages of your life. So I say to my families, and this is an important part of my consultations, where I talk about how's your mood? Are you experiencing any anxiety? Or are you experiencing any low moods or hopelessness? It is important to treat. It does not even affect you at the time when you have low mood. So say I'm upset about something or I'm anxious about something, of course at that time I won't pay attention and I won't be as online as I should be. I won't be as mindful as I should be. But over long term, staying in states of depression or anxiety has also been linked to having a higher risk of cognitive decline later. And when my family say, what should we do? I say you could do talk therapy with psychology, you could do medications with psychiatry, or you can do a combination of both the talk therapy as well as medications. Which one has the best evidence? Well, the combination, of course, because it combines the best of the both worlds. Now, one of the obvious things that happens in mid-age that can increase your risk of having cognitive decline is having a head injury. We know that having head injury can sometimes initiate inflammation in our brain that can later lead to having dementia. Therefore, we say avoid having head injuries. Now, another thing that we also talk about when we think about our midlife is exercise. I know, right? Everybody hates this topic, but it is one of the most important things that you can do for your brain. It is actually when I'm discussing this topic to the family member who has the dementia, or the family members who come with the individual who has dementia or cognitive difficulties, and when they say, what is the one thing that we can do to reduce our cognitive decline? I say it is exercise. And again, you may say that really doesn't make sense to me, exercise and reducing the risk of dementia. So it's not just saying things like, oh, it improves your mood, or oh, it's good for your heart, oh, it's good for your brain. Not things like that. We have a big scientific reason for saying that exercise protects you against dementia, and that is a chemical called as brain-derived neurotrophic factor. Fancy long name. Basically, this is a chemical that our body secretes when we are doing aerobic exercise, and this is the chemical that goes to our memory centers, and guess what? It increases the size of our memory centers. Now, I bet you to find anything that does that except exercise. There has been not a drug in this world that can do that. And once we have such a drug, it of course would be a billion-dollar industry. So we don't have anything like that, but exercise is something that we can do to improve our cognitive health. Now, this particular chemical is typically secreted when we do aerobic exercise, and when we talk about exercise in relation to having cognitive decline or dementia, we think about it as a very specific prescription. So you need to do about 150 minutes of moderate intensity exercise over a week. That could look something like 5 days of 30 minutes session in the week. Now, if you want to learn more about exercise and how to know if you are in the moderate intensity, or how to know if you are doing correct aerobic exercise for yourself and how to ramp up to get to the 150 minutes, I recommend you to watch my video on exercise, because I have gone into great detail answering questions like these. Now, last but not the least, the late ages or the late stage of the life. There are 3 important risk factors that we can work on to improve our cognitive health. Number 1 is vision, and that kind of explains itself. We have a lot of vision issues as we age. We have problems like cataracts, macular degeneration, retinal detachment, glaucoma, you name it. And these things, again, just as we were talking about hearing, vision actually has a much larger area in our brain dedicated to our visual senses. And so if I'm not stimulating my brain with the beauty that is outside, and if I'm not able to see things that are outside, I will not be using a big part of my brain. And therefore, we say that if you are having any vision issues, make sure to get them corrected. Another important part of the brain and another important function of the brain is social cognition. So that is why when people are isolated, they are at an increased risk of developing cognitive decline. Now, what is the social cognition, and what exactly am I talking about? So social cognition is things like, how do I interact in the situation to have an outcome that I desire? How do I understand what are the intention of different people in a social dynamics? Maybe at work, maybe at home, maybe in my community. So understanding all that takes a lot of brain power, planning your reaction to something that's happened or anticipating a reaction from an individual you know. All that takes a lot of mental energy, and that is why we say you need to stimulate that part of the brain by having enough social interactions. And if you are isolated for some reason, you are at a higher risk of developing cognitive decline. Now, you might have noticed a pattern. Almost everything we talked about dealt with something with your health, like physical activity, hearing, vision, cardiac health. So coming to last but not the least, one of the most interesting factors which is listed under the late life is actually air pollution. And you may realize that since all the factors that we have discussed, this is the only risk factor where the things are external. So the risk factors that we discussed so far were eyes, ears, heart health, exercise, things like that. But this is one thing that is in our environment. And so what this commission report stated was that older individuals who lived in regions where there was a lot of air pollution had a higher chances of having cognitive decline. So this kind of goes back to our previous knowledge in terms of other environmental exposures such as pesticides, which are linked to development of certain kinds of dementias. Just kind of being very mindful of also the air quality for where you live. So these are quite a full modifiable risk factors. And when I talk to my families, I always say, don't get overwhelmed. Pick up one thing that you can work on and start working on it to improve your cognitive health. None of us are perfect. None of us can do all these things perfectly, but it is good to recognize that, okay, in this particular month or in these few months, I'm going to work on my blood pressure. And once that is addressed, I'm going to work on increasing my aerobic exercise and such. So you kind of think about one factor at a time, one lifestyle change at a time, because although these are all in your hand, these are definitely calling out for lifestyle changes. And whenever we think about lifestyle changes, it is not as easy, and individuals can feel overwhelmed or defeated when they think about so many factors all together. So what I want you to get from this is these are so many factors that are in our control, and we can possibly think about what is the most important, what is the most critical factor that I can fix, and then move on to the next one. Now, one thing that my families often say is, well, I did not take care of a higher education when I was younger, and that was something that was not in my control, and I don't have such high level of education. And does that mean that I'm doomed now? And I tell them the very interesting study that was done in England, where they studied the memory centers of individuals who were taxi drivers or cab drivers, as well as the memory centers who were bus drivers. Now, both of them are driving, but they are slightly different. And how is that? So taxi drivers in London back in the day, when we didn't have GPS and technology, had to learn all the routes. And the bus drivers, on the other hand, of course, they also had to learn the routes, but they had some kind of regularity with going back and forth along the same route, as compared to taxi drivers who had to know all the streets and all the little alleys and ways around in London. And to be able to pass this examination, they had to undergo this learning. And when they compared the brains of these two groups of individuals, they actually found that the memory centers of taxi drivers were bigger as compared to the memory centers of individuals who were driving buses. And this again is really exciting because these individuals were 50 years or older. So this tells us that if we continue to challenge our brain in healthy ways, whether it's cognitively, visually, audiologically, socially, it does make a difference in our cognitive health, and it can decrease our risk of developing cognitive decline or dementia in the long term. So hopefully this video was helpful. I'll see you again in the next video. Till then, please take care and goodbye.